Now I'd like to give you a demonstration of our system. This is a demo system, and I'm logging in on the cloud. These patients are fictitious, and you saw that there is a password to log in for every user. So here we have a demonstration system, and first of all I'd like to show you how to find a patient. So if we want patient number 6, we do a search and we have all the details of patient 6. The first thing to do though is to add a patient. So hopefully this will show you how simple it is. When a patient registers, even people with limited computer ability should be able to complete this without much difficulty. So the patient arrives and we put his name in, indicate what sex he is, date of birth. It's an easy drop down, so we can just scroll down in the usual way. We'll say his date of birth is 11th of May, his next of kin. All these boxes, apart from name, address and date of birth, are variable. You don't have to have next of kin in, we can alter that. So we now put his address. There's predictive text in the addresses, so when you locally, when you have people from similar areas, it will predict once you've put the village in if you've added that village before. Categories of patient, again this is purely voluntary, you don't have to do that, as we do with mobile number, but we find that most people do like to have a mobile number down. Religion again is optional, as is language. So when all those boxes have been ticked, the patient is registered with on the system. So that's registration, which is really quite easy. So then when a patient comes to the clinic, they're previously given a number. We can search by number, or we can search by surname, first name, parish or village, but hopefully most people know the numbers. So if a patient comes for consultation, they give their name or number, and then we've got the details which we've already added on before. And now I'll take you through the tabs of the 5 different options that can happen in the clinic. So first of all, observations. These are in the form of weight, head circumference, respiratory rate, blood pressure, temperature, mid-upper arm circumference, height and heart rate and blood sugar. These are variable. We can add and take off at your request. So again, to fill in these boxes, I'll do it very quickly. Just press the date, just press enter, and the date is automatically entered. So whatever measurements you want can be put in, basically. And it's just a case of putting the figures in and pressing enter. It's predictive for if blood pressures have been put in before, those levels will be automatically predicted. Save typing, etc, etc. And then you just press insert and all those details are on. Immunisations, very easy to enter. If we click on the immunisation tablet, so today is immunisations, and then we have a picking list of all, and we can alter this picking list at your request. So it's just a case of putting in whatever vaccination has been done and pressing insert, and that's vaccination. Consultations, the whole idea of course is to build up a chronological record of what's going on with the patient, and this is a patient who's been seen before, so we can see what the patient was given previously. And then as far as today is concerned, if we press edit, we already have above the observations that have been entered previously, maybe by a nurse before seeing a doctor, or it could be the same person adds these conditions. It doesn't really matter. But the important thing is that everything is linked. So if this patient is coming to the surgery, etc. We put the notes in, and then we can put what medication and treatment we've given. And then at the end of the consultation, we just press update, and then we have a chronological record is slowly being produced. The whole essence of this is simplicity. Clinicians who have been used to more sophisticated systems may think that this is too simple, but for people who are in the developing world, who are using a computer for the first time, we've found that this is very easy to use. And then the important thing at the end is to code a diagnosis. We have 80 different, at this point, diagnoses to choose from. These we can tailor-made to whatever you want. So, for instance, if this person is suffering from diarrhea, just for simplicity, basically you have a picking list of types of diseases: epidemic, infectious, maternal conditions, minor operations. But I'm going to say that in this case we've got an infectious communicable disease of diarrhea. The date is today, and if we insert that, then we then have a code of that particular illness. And as a consequence of disease coding, we're able to run reports and find out the prevalence of different illnesses. We can also find geographical location, and I'll make another clip, you'll see another clip of how we can use the reporting system. So I hope that's been a useful demonstration of the system. There is a lot more to it than that, and if you require, we can send you a link so you can actually practice on the system yourself and see if it's suitable for your needs.